Hello, good evening, and welcome to JoyNews Prime with me, Carlos Caloni. Our headlines this are: the hospitals continue to reel under the impact of erratic power supply, despite calls from the Ghana Medical Association and Minority on Parliament Health Committee to exempt medical facilities from the ongoing load shedding.
As an association, what is important is that for critical installations as hospitals, they need to know the timing of these outages and so that they can plan.
We'll bring you details as ECG assures of a stable national power supply in light of businesses and communities grappling with the impact of interruptions in power supply. Also, NDC flag bearer John Mahama promises to create a ministry focused on youth development if elected in December.
My vision for this ministry will be that it will focus on mainstreaming youth interests in all sectors of the economy.
And as Ghana joins the rest of the world to observe Easter, the country has been charged to reflect on the message of the period to ensure good governance.
Such as the 12th Easter Festival is a hotspot for HIV transmission.
We'll have prime business as well. This is your home of independent, fearless, and credible journalism. Please stay with us. Thank you so much for joining us here on JoyNews Prime. Let's begin from health, where health facilities in the country continue to suffer the effect of intermittent power supply, despite heightened calls to exempt them from any scheduled power outage. Now, a minority in Parliament yesterday pushed for the immediate exemption of health facilities from the current unscheduled load shedding exercise. The Ghana Medical Association believes this, among providing a structured load management timetable, will prevent possible healthcare disruptions. But the Children's Hospital, located in Accra's Central Business District, suffered nearly 6 hours of power cut on Friday, March 29, 2024, compelling the hospital management to resort to the use of generator for the period. JoyNews' Stanley Blew was there and has filed this report.
The Children's Hospital was among several designated areas that the Electricity Company of Ghana cut power supply to on Friday, with the power distributor attributing the situation to technical challenge. However, at about 2:30 p.m. when the news team visited the facility, power had been restored and newborn babies with complications were being attended to by doctors. The medical team on duty, however, declined to engage the news team on the power situation. But sources within the hospital say the power outage has become a frequent phenomenon the health facility is confronted with, as a chunk of the hospital's internally generated funds are spent on fuel to sustain power supply.
For us, as an association, what is important is that for critical installations as hospitals, they need to know the timing of these outages and so that they can plan. Remember, this impact is not only on patients' lives, but also the financing of generators using fuel. For example, that is a lot of cost, knowing how fuel prices have also gone up.
The issue about the intermittent power supply to the Children's Hospital came to light a day after a similar situation was reported to have claimed the life of a baby at the Tema General Hospital. But management of the hospital has since denied that report. Calls have, however, been heightened for critical national installations such as hospitals to be decoupled from any planned outage due to the risk it could pose to the lives of patients. But the Electricity Company of Ghana is yet to adhere to that concern.
Even if they don't regard us as human beings who deserve to have load shedding timetable to be able to plan our lives, we are simply telling them that they should not push us into our early graves. And so with immediate effect, what we are calling on government to do, or the ECG to do, is that all the health facilities in the country, especially the public ones, must be exempted from these power outages.
Meanwhile, the Electricity Company of Ghana made more than 100 power outage announcements in the first half month of this year. Now, the majority of it due to maintenance works. This is contained in the ECG's response to the Public Utilities Regulatory Commission following the regulator's demand for ECG's publications informing the general public of power outages this year. Kofi J is with our data and research desk here at JoyNews, and he has details in the following report.
What we know is that out of the 8 orders PURC gave ECG, 3 of them were queries and 1 of them was the demand for power outage publications. So per what ECG submitted to the PURC, we were able to count about 104 power outage announcements by ECG between 2nd January 2024 and 21st March 2024 alone. Now, according to the ECG, about 73% of the outages were due to the maintenance work. That's contained in the document they presented to the PURC. But if you do an analysis of what ECG presented to the PURC, we realize that most of the publications that were submitted were repeated. And so if you do the validation, the number reduces from 104 to 49. Okay. And they blame 27 out of it to plant maintenance. Technical challenge, 12 out of the 49. Grid code technical challenge, 3 out of 49. And grid code maintenance is around 4 out of 39, Mami.
Right. Well, the Commission says it has passed on ECG's refusal or inability to provide the information to the commissioners who will decide what should happen. But we were told earlier there could be sanctions, and the chairman of Parliament's Energy Commission is not pleased with what is going on.
Well, so first of all, the ECG actually failed to comply with 2 demands. One key of them, which is the publication of load shedding timetable. And just like you said, the ECG says that, if you look at the refusal or inability to provide information to the commissioner who would decide that should happen. In fact, we are talking about the non-compliance. So the commissioner is going to decide on what should happen. But we were told earlier that there could be sanctions.
We've transmitted whatever it is we have to the commissioners. I cannot give a deadline or time to the commissioners. So if the commissioners come out and tell us that by this time we are doing A, B, C, D, I'm more than willing to come out and communicate that to the public.
Safe to say that you're happy with the remainder of the directives and the ECG's compliance with those?
Well, there's another level of compliance. They're supposed to comply with the rest of the orders by April 2nd. That's next week, Tuesday. So we are waiting to see if maybe some other things in terms of the timetable will be added to those ones which will be brought in by April 2nd. Until then, this is what we have, and this is what we are working with.
We also know that there are still challenges with GRIDCO. I mean, this is a separate question to you as a regulator for the sector, because in the last 48 hours, there have been 2 notices from the ECG, all referencing a shortfall in supply triggered by GRIDCO challenges. Is the PURC looking into that too?
Once PURC has information to that effect, and we have engineers who work on this all the time.
Now, the Member of Parliament for Ibuakwa South, Samuel Attah, who also chairs the Energy Committee in Parliament, is livid with the refusal of the ECG to release a load management timetable. He described the ECG's refusal to provide a timetable as unprofessional and inappropriate.
It's very unfortunate that we need to be harassed by, if you like, matters that we've not interrogated. But that's how I see it. And I agree with Rankin that there was necessity for ECG and the rest of them to come before the committee for us to interrogate and tell to everybody where is the problem. Because whatever you say, which is going to solve the problem, what we need to do is that what you have to do, if we are responsible, you need to do it. And then we get out of this mess. But what we had, and I'm very, very honest with some matters, that when we wanted ECG and the rest of them to congregate so we interrogate the matter, we had an intervention from the minister that is out of the jurisdiction. But in such a very important interrogation, he wants to be seated. That's how come we never got around to interrogate the matter. But it is imperative that if you have a challenge, whether it's a matter of generation deficit or a financial challenge, let the people of Ghana know that there's this challenge and this is the timetable. So people will plan around the challenge you are facing. To make it like it's a fetish that we don't know whether today I'll have power in my area or I won't have power, how people iron their clothes to get to work and the rest of it, and all the challenges. I don't think that's the way to go.
Away from the power issues, NDC flag bearer John Mahama has promised to create a ministry focused on youth development if he wins power in December. Speaking at the inauguration of the NDC's National Youth Wing Secretariat, the former president said the current youth and sport ministry is largely focused on the Black Stars, sidelining the well-being of the youth of this country, who make up the majority of the population. The following report has more.
National Youth Organizer of the opposition NDC, George Opariado, says the party will make sure that every vote is counted in the December polls, a reason why they have established the NDC National Youth Wing Secretariat and Campaign Center here in Accra.
We just commissioned our command center for the 2024 elections. This is the Youth Wing Secretariat. This is where we'll be running our operations from in respect to the elections of the 2024 campaign. And every Ghanaian knows that where Ghana stands today, it is in our best interest to make sure that every single vote that is cast is properly counted for and accounted for. And so we will police the ballot at the peril of our life.
What does that mean?
To make sure the right things are done and nobody takes us for granted. If I vote, my vote should be counted and must be counted and accounted for. Nobody, and I repeat, nobody, being it an electoral officer, a police officer, a military officer, or anybody, not even the president, should attempt to take the mandate of the people for granted.
Meanwhile, former president and flag bearer of the party, John Dramani Mahama, says the youth will be at the heart and center of his next administration. He is promising to separate the youth and sports ministry when it comes. So he says that in his next administration, there will be a ministry dedicated to youth and another dedicated for sports.
We're going to separate youth from sports because it's a youth and sports ministry. But over the years, what we know is that the concentration is just on sports. And even on sports, the concentration is just on the Black Stars. My vision for this ministry will be that it will focus on mainstreaming youth interest in all sectors of the economy. It will focus on mainstreaming youth interest in all sectors of the economy. But most of all, it will concentrate on rolling out strategies that will create jobs for young people.
Well, General Secretary of the party, Fifi Kwete, is also encouraging the youth to take up leadership positions and says the party has them at heart in their next administration.
This country and this party became what it is because of young people. In 1951, when our founder, and I'm talking the founder of our country, became the head of government business, he was 42 years. 42 years. And that tells you the power of youth, even in shaping the destiny of our country. So what is the greatest prayer is that this party become populated by millions of you young people who see beyond yourselves. We see a party that is made up of millions, and what you can do to make sure these millions are in the place they ought to be.
With a few months to the December polls, campaigns have started heating up between the main parties, the MPP and the NDC. Meanwhile, the other parties are also heating up campaigns. Kenneth Jesse for JoyNews.
Now, away from that story, fresh data emerging from the Ghana HIV and AIDS Network, Garnet, has revealed that petty traders are contracting HIV more than their counterpart in other occupations. Garnet in 2023 commenced the pilot of a self-testing regime in 50 districts across the country, targeting 50 different categories of occupation, including students who received the highest number of test kits. However, a self-report-based data collected by Garnet at the end of the pilot revealed that 65% of those who tested positive were petty traders, constituting the largest number of confirmed HIV positive cases. My colleague Isaac Kufieje is with our research desk, and he joins me via Zoom with details. Kofi, this fresh data emerging from the Ghana HIV and AIDS network has actually revealed that the petty traders are contracting HIV more than their counterparts in other occupations. Now, give us a breakdown of that data on infection rates per occupation. Kindly unmute your device, Kofi, so we can hear you.
Right. So this time around, the Ghana and the Ghana AIDS Commission wanted to know the total number of people living with HIV, or get an estimate by using the self-testing approach. And so, according to the data that was churned out of after this exercise, you realize that a majority of the people who actually tested positive, just like you said, were petty traders, followed by farmers. There were unemployed persons and also people engaging in other trades and other skills like seamstress. But in the corporate space too, we had a significant number of people also testing positive. And so that is the outcome of the self-testing exercise that was carried out by Ghana.
All right, so is there any correlation between occupation and the rate of infection? Have you been able to establish anything like that?
Well, so we've been looking at the data, but currently we do not have sufficient data to perform a certain correlation analysis or regression analysis. But also, it is not to say that, once you see the percentage of petty traders higher, means that HIV is higher among them. It's possibly because they decided to participate more in the exercise. So currently, we've not been able to, draw that correlation between HIV status or infection or positive status and occupation. But what we know is that per the self-testing, the exercise that was carried out, persons who engage in petty trading were the majority of those who actually tested positive.
Kofi, we are grateful for your time, for the insight. All right, so joining me on Zoom is Elsie Aye. She is the National President of People Living with HIV. Thank you so much for joining us here, Elsie.
Thank you, too, for inviting me, and good evening to the listeners.
All right, madam. So the recent Ghana pilot on self-testing shows that petty traders are leading the chart when it comes to, infection rate. What could be accounting for this particular development?
Thank you very much. This shows a gap in the people who have information. We know that many people in the general population do not have information about HIV. And the prevention education hasn't really gone down well. We hear many people asking, so is HIV still in the system? HIV is very much in the system. And we have many new infections coming, recorded year after year. So the petty traders, we see that they are the ones who are so busy with their work. They haven't really been targeted for education on HIV. And in the media also, we haven't seen a lot of information or education on HIV. So these people, it's just very clear now that they are the ones who have not been reached. And there's a lot of work for us to do, reaching out to them.
Reaching out to them in terms of the national response messaging targeted at them, is that it?
Exactly.
All right, so what do you think can be done to address this particular trend?
Well, we need to carry out more assessments to know how we can best reach them, and the mode by which we can pass the information to them so that they would understand. It's not everyone who speaks English, not everybody would understand, and we have different languages also in Ghana. So if we are able to package the information in a way that will reach them in their language, wherever it is they are, then I think we'll be able to cover them. They are the hard-to-reach community that we really don't think about. But this has brought it clearly that we really need to reach out to such people.
Madam Elsie, we are so grateful for your time, for speaking to us here on JoyNews Prime. Also joining me is Dr. Stephen Asiado, who is the Programs Manager at the National HIV AIDS and STI Control Program. Doc, what is your own interpretation of this fresh data from Ghana, and why should men be targeted a bit more in the fight against the disease? Because it appears that the women are actually testing more than the men. Why? What do we need to do?
Well, thank you. First of all, I have to put on record that this study was purpose. It was not purpose. It was just random. They went ahead to do it, but it's not really strict randomization. Okay, so they went to various workplaces, but they didn't necessarily focus on, let's say, the formal working sector. They went to the communities, and they distributed all of these test kits. And as we saw in the report, you could see that they interacted more with people, the petty traders and all that. And in that sector also, you find a lot of females who are very big, who dominate that area. So it's not surprising that 60% of the people who were tested were females compared to males. However, we also know that irrespective of the fact that that is female dominated, there are also a lot of men in that sector. But when we compare the health seeking behavior of men compared to women, it's better for women. All right.
Hello, Doc. Okay, so that's Dr. Stephen Asiado there. Hello. All right, so as you can see the data there, Ghana HIV AIDS Network, Ghana's 2023 survey, you find 123,088 HIV self-testing kits were actually distributed in various districts across the country. Doc, if you can hear me, you were making a point earlier, if you could just land on the point.
Yeah, so I'm saying that more health-seeking behavior of men compared to women is lower. So in such a sector, it's likely to find more women accepting to test. But this also shows, it actually affirms what we see in routine healthcare service. We find more women who are reached with HIV services compared to men, which means that we need to now be very deliberate in targeting men, because our population dynamics also show that there are more men in Ghana than women, males or females, by population ratio. So we need to deliberately target the men. And the studies also show that most of transmission, that is, the men are more likely to transmit to a woman than a woman to a man. So it is good information, useful information that we need to use to deliberately target this particular population of men who are high-risk men. And this has to be scaled up, because this was just 50 districts.
Yeah.
And we need to look at both the informal and formal sector as well. And I think the most vulnerable groups are in the informal sector, and we need to pay attention. For the past 6 years, the behavior change component of prevention has not been funded. There is funding for condom use, but its promotion has not been very vibrant, because you need resources to do the legwork. And we are looking at tackling that. If that is, if we're able to achieve that with the AIDS fund, then that aspect will be focused on. We need to go back to the communities and link the prevention education with the testing. That is the only way we can be able to fill this gap.
All right. So finally, before I let you go, the Easter festivities is on, and a lot of people are likely to engage in all kinds of risky behavior. How concerned is the Ghana AIDS Commission in terms of mitigating infection rate around this time?
Okay, so the Ghana AIDS Commission has been proactive. We have provided some test kits to the Commission that, and they're going to test in addition to condoms. So always for such festivals, we make provision for that, for the Kweu and all the other places, so that people can utilize it as much as possible. So usually now we're also doing targeted based on events. So not only festivals, but depending on the event, sometimes even during the Valentine period and all that. But what it is in Ghana is that we need to do this all year round, because you see, It's not only linked to festival. We have to do it all year round.
All right.
Because HIV is not very visible now, it's subtle, so we need to tackle it every month. And this must be systematic. We need to focus on students. This data also shows that we need to focus on students.
Exactly.
People in the tertiary institutions, because they have missed the previous education that we provided to the population.
All right.
They were not born, but they were children. So that is also another important area.
All right. Thank you so much, Dr. Isiadu, for speaking to us here on JoyNews Prime. We're grateful for your time. Oh, meanwhile, the Ghana AIDS Commission says it is concerned about how people have fun during this Easter festivity, especially for those who will engage in sexual activities. It's been an open secret that commercial sex workers infiltrate the revelers and money to win the minds of innocent men and women and engage in sex for cash. Director General of the Ghana AIDS Commission, Dr. Stephen Treme Echiahene, says that's a dangerous practice.
Our strategy is risk reduction. And so one of the things that we find as a risk factor is events. Events such as the Kwauf Easter Festival is a hotspot for HIV transmission. And so the Commission, right from the beginning when government launched the tourism event for the Kwauf Easter and paragliding events, the Commission collaborated with the Ministry of Tourism, and we have since been running HIV programs during Kwauf Easter every year. And so in every year, we set up health screening and condom distribution centers in all the three districts within the Kwauf enclave. And at these centers, we provide counseling and testing for HIV and other diseases. And we also give out free condoms so that people who have romance on their minds should also think of protection. And therefore, we make these, we make condoms available to them.
Still on the Easter festivities, some church leaders have been sharing with us their views on how the leadership of the country can benefit from the message of Easter. Speaking to Raymond Akwa on Upfront, former president of the Catholic Bishops' Conference, Most Reverend Joseph Osebonso, asked President Akufo-Addo to be forthright with the people on his stance on the LGBTQ bill.
Now, if you are the president of the nation and you appear to be dilly-dallying, give them praise that you don't want to sign it, the people, know what to do, because there's something that they don't like. They don't want LGBTQ, period. And so if you come out and give the impression that you are afraid to sign it or something, then they will advise themselves. I think the president should have made his position known. When he came to Mampong about 2 years ago, and he made a declaration there, and I was there, and he said it won't happen in his tenure that LGBTQ will be accepted in Ghana. He said, I repeat, and so on. Now he seems to be sitting on the fence. So we want him to come out. Now let him set his position. If the Supreme Court comes out and says your position is wrong, fine, but we want to know where you stand. Previous presidents have made their positions known. President Mills is a classic example, President Kufuor, and so on. But with him, we don't quite know where he stands. So,
now, on his part, former General Secretary of the Charismatic and Pentecostal Council, Reverend Dr. SN Menon, asked President Akufo-Addo to think about his legacy and give hope to the suffering masses.
We are living in very difficult times. Situations are very hard. Life is becoming extremely unbearable for the people, from the ordinary man and woman on the street to businessmen and what have you. Their businesses are collapsing. Mr. President, think about your legacy. How would you be remembered? About the lives you have improved. Leadership is about improving the lives of people. And for Easter, Easter is a message, like Dr. Pundi said, a message of hope, and also a message of sacrifice. In this difficult moment, the president must give hope to the people of this nation. He must practice and show an example that is feeling for the people. Possibly, he can reduce the number of his ministers on board, and then that will send a clear signal to maintain a minimum expenditure, to probably give a sign that, listen, I'm listening to you, I'm feeling your pain, and I will be able to do something about it.
Now, for our road safety campaign, here are some tips from the National Road Safety Authority as Christians observe the Easter festivities.
What we are doing is that our men are talking to drivers, we are talking to pedestrians and occupants of vehicles for them to behave within the limits of the law, particularly overspeeding, as we said. We do not want people to speed beyond the limit. We are talking to them to wear their seatbelts and not to drink and drive, at the same time to lower their speed as they traverse from the Accra corridor all the way to Nkoko in particular. We started early morning, before 6 we were here. We understand the IGP and the team also were here yesterday all the way to 10 p.m. in the night. We are sustaining those efforts, and as I speak to you now, the entire stretch is congested. Vehicles are moving at very slow pace, and it's all the way from Bunsu area to Nkoko, which means that a lot more vehicles and a lot more people are traveling today.
Now, delivery of quality healthcare in the Upper West region is suffering setbacks following high attrition rates of critical medical staff. Upper West Regional Director of Health Services, Dr. Damien Punguri, revealed that whilst 134 staff left the region last year, only 35 staff were posted to the region. Addressing the 2023 Annual Health Sector Performance Review meeting, Dr. Damien appealed to the Ghana Health Service, Medical and Dental Council, and the Ghana College of Physicians and Surgeons to speed up the accreditation processes to avert the Upper West Regional Hospital into a specialized training center to nurture more health professionals to augment the situation. My colleague JoyNews as Upper West Regional Correspondent Rafiq Salam report from WA.
The 2023 Annual Health Sector Review meeting of the Upper West Regional Health Directorate was held on the theme Embracing the Networks of Practice approach to improve health outcomes in the Upper West region. It brought together major stakeholders in the health sector to share their successes and challenges with a view to providing solutions to the latter. Upper West Regional Director of Health Services, Dr. Damien Punguri, first laid bare the successes chalked under the year in review, which included the maternal and child health e-tracker and the electronic medical record system, which were fully deployed in all district hospitals and some clinics in the region.
This has significantly reduced operational costs and waiting times for clients accessing health services in these hospitals. Currently, if you go to any of our hospitals, you don't need to carry your folder or lab requests or anything. Even if you forget your ID card, just mention the correct name and then your information will access.
Dr. Damien Punguri then channeled figures of some selected indicators realized. Maternal deaths increased from 16 to 19.
Institutional neonatal mortality dropped from about 6 per 1,000 live births in 2022 to 5 per 1,000 live births. And stillbirth rate declined from 11 per 1,000 births to about 7 per 1,000 births. However, the region recorded 19 maternal deaths during the year under review compared to 16 in 2022, which means that 3 more deaths were recorded. And this is something that as stakeholders we need to work assiduously to reverse.
Turning to challenges, staff attrition continues to be a major drawback in the region's quest to achieve quality healthcare delivery. In order to put a lid on it, the Upper West Regional Director of Health Services suggested for a speed up of the accreditation process to convert the Upper West Regional Hospital into a specialized training center.
During the year under review, 134 staff left the region on transfer compared to only 35 who joined us. Even though the number of medical doctors in the region keeps increasing year after year, the majority of them are currently in school for their postgraduate training, and some will be away for as long as 6 years, which implies that they are not really available for service delivery. To address this problem, I humbly appeal the Ghana Health Service, the Medical and Dental Council, and the Ghana College of Physicians and Surgeons to speed up the accreditation process of converting the Upper West Regional Hospital into a specialized training center. This will enable the doctors in the region to specialize while still at post.
Dean of the School of Medicine at the CK Tadem University of Technology and Applied Sciences, Professor Juventus Ziem, had similar suggestions.
This problem can easily be solved. You have a university here, and the university mandate is in business and integrated development studies. Integrated development studies cannot occur without integrating the various aspects of development, i.e. health, economics, business, agriculture. So the mandate is clear, and it is only left with us to collaborate with the university to start demand-driven programs in this region that will stop the staff from moving far away for extra learning. It is possible. We can do it.
There was a presentation of the holistic assessment report of the Upper West region, which was done by peers from Western region. 33 health staff who distinguished themselves at the national, regional, and district levels were rewarded with citations and television sets. There were also citations of appreciation for some journalists in the region for the roles played in fighting the COVID-19 pandemic and the cerebrospinal meningitis, CSM, in the region. One of them was JoyNews Upper West regional correspondent, Rafik Salam. Reporting for JoyNews, Rafik Salam. Wow.
You're still watching the JoyNews Prime with me, Carlos Caloni. We'll take a short break. We'll return with more. Please stay. Welcome back. In business, the Acting Commissioner of Insurance, Michael Ando, has revealed that insurance companies will soon be required to design and publish their claim processes. He said this is a new directive by the National Insurance Commission aimed at making it easier for insurance customers to make their claims. Ando was speaking to journalists at the 9th Annual Educational Conference and Exhibition of the Insurance Brokers Association of Ghana held at Bolgatanga in the Upper East region. Correspondent Albert Sori has more.
The Insurance Brokers Association of Ghana, IBAG, is an association of licensed insurance broker firms in the country. The association's core mandate is to spearhead the affairs of insurance brokers. IBAG has concluded its 9th Annual Educational Conference and Exhibition held at Bolgatanga here in the Upper East region. The focus of this year's conference was on improving customer service and educating the public on the importance of signing on to insurance. It was on the theme, Building a Consistent Customer Service Culture, a tool for increasing insurance penetration. Speaking on the theme, the president of IBAG, Shaibu Ali, said, bad customer service remains the biggest challenge for the insurance industry in Ghana.
As an industry, we know the challenges we have with penetration of insurance in Ghana. Some of the reasons for the low penetration include disposable income, a lack of disposable incomes for consumers of insurance, lack of knowledge and appreciation of insurance by the populace, the general economic situation, etc. Aside this, however, one key reason for low penetration is the issue of bad customer service, which is plaguing our industry. In the recently published survey of the Ghana Customer Service Index, insurance placed last on the log of providers.
Upper East Regional Minister Stephen Yakubu, in his address, called on the insurance broker firms to address the difficulties often faced by insurance customers in trying to make their claims. He said it was one of the major issues discouraging Ghanaians from patronizing insurance firms.
Is it about the business alone to make profit, or is also about the clients? We should be able to find a middle ground. How the person who is insuring his car is capable of paying, so that I know that if I insure my house contents, if something happens to my house, then straight away I can pick a phone, call someone, and I will get someone to talk to. Sometimes you call, there's no one at the other end of the phone to pick your call and even to talk with you. In Accra, with this traffic, you have to drive all the way to the office. These are things that I think we should always be mindful of.
Now, the Ghana Fintech and Payment Association is calling on the Bank of Ghana to expedite action on the implementation of policies to address emerging technologies in the financial technology space. Speaking on JoyNews Business Social, its president, Martin Awaga, commended the regulator for its efforts in sanitizing a fintech ecosystem, but want more to be done. His call comes on the back of the rate of the evolution of the sector to spur growth and remain competitive.
Mobile money interoperability existed before, COVID hit. And, that was a win for us as a country. Then innovation, like I just mentioned by the debate we had in our event recently, innovation would always precede regulation, no matter what. So we need to find ways and means to push regulation a bit, because with the speed with which AI, DLT, IoT, and all this, technologies that we are seeing coming, regulation has not even scratched the surface of this already. Policies have not really scratched the surface. So I think, for a large extent, policies have been slow, yes, but kudos when it comes to the financial sector. Kudos to the Bank of Ghana for what they are doing.
Next is sports.
Hello, welcome to the sports segment with me, Razak Musbao. Now, the Confederations Cup action, and it's Ghana Premier League side Dreams FC who will be in action, and they'll be facing Malian side, Stade Malien, in the quarterfinals of that competition, looking to progress to the next stage, the semi-finals. Now, the first meeting of the two-leg fixture is on Sunday, and it will be happening in Bamako, Mali. Ahead of the game, head coach of the side, Karim Zito, says his side will look to claim all 3 points while they keep sight on advancing to the semi-finals.
Well, we are going there with two objectives. First, we are going in to win. If not, the best resource is to come out with a draw. So these are the strategy we are going to map up and go there. So that is my expectation. So when you look at, I try to do the same tactics against Mediama. When I just played them last Sunday, I went in, they came in, and later I decided to draw with the game, and then we had our draw, which is our second option. So we are going there at least to have a point or 3 and come back.
Now, so coming back home, what's the expectation returning home? What should the fans?
Well, at the end of the day, our expectation is to qualify to the semi-finals.
Okay. Yeah, that game will be on Sunday. Now, let's turn to some European football, where Xabi Alonso has been speaking on his future, and he says he will remain in his role as Bayern Leverkusen manager next season, as he believes the club is the right place to be as a young coach. Now, the Spaniard had been heavily linked with manager's job at Liverpool and Bayern Munich following an impressive first full season at Bayer Leverkusen. However, the 42-year-old believes he still has more to offer the club, which took a chance on him. Well, that's Xavi Alonso there committing his speech to Bayer Leverkusen, and that's all we've got for you on sports. Well, Carlos, that's it.
Interesting sports we have there.
Yeah, interesting sports. Good Friday.
Yeah.
Friday.
Sure.
And looking forward to Sunday, right?
Exactly. All right, so that's all we have. You can log on to myjoyonline.com for more stories. My name is Carlos Kaloni. Thank you so much for watching. Have a good evening.